All right, we are gonna try this. Welcome, welcome. Let's see here. Aha, there we go. I see Dr. Nisha, you're on, so we are gonna do a couple things, let a couple people get in here, and then we will get started and do that. I will pull you on in a bit. Oh, I love starting on time. Let's go ahead and do this. Hello, everyone, and thank you for joining us for Instagram Live for this heart-to-heart conversation about women's heart health. I am Irina Ninge, Chief Science Officer for the Society for Women's Health Research. SWHR is a nonprofit committed to advancing women's health through science, policy, and education while promoting research on sex differences to optimize women's health. Ischemic heart disease refers to reduced blood flow and oxygen supply to the heart, often caused by plaque buildup in the arteries surrounding the heart. IHD, also known as coronary artery or coronary heart disease, is the leading cause for death for women in the United States. According to the CDC, approximately 4% of women ages 15 to 49 years, 9% of women ages 50 to 64, and 12% of women ages 65 and over die from heart disease. Women often experience different risk factors and symptoms of IHD than men that contribute to disparities observed in the prevention, treatment, and outcomes for ischemic heart disease for women. So today, SWHR has invited a cardiologist and women's health expert, Dr. Nisha Goldberg, to hashtag SWHR Talks Heart as we discuss IHD prevention and treatment with a special emphasis on young women. And I'm going to bring her on. Is she? Awesome. And we're going to get there. And great. I see the invite, but it's not logging. Let's see. Awesome. All right. Let's see if we can get this on. There we go. I think we got it. Or not?
Here I am.
Yes, there she is.
Thank you. Hi, Irene. It's great to see you.
To see you as well. Let me do a proper introduction now that you're on. Dr. Goldberg is the medical director of Atria New York City and a clinical associate professor of medicine at NYU Grossman School of Medicine. She is also an author and a host of podcasts, Beyond the Heart, Improving Your Heart One Conversation at a Time. If you've heard of Go Red for Women campaign, that is her, and a nationally recognized pioneer in women's heart health. With a long history of championing women's heart health, not just in her home state of New York or current state of New York. I'm not sure if that's your home state.
Current state.
Dr. Goldberg is a national spokesperson for the American Heart Association. We are very excited to have her here with us today. Welcome, Dr. Goldberg.
It's great to be with you, Irene, to talk about something that's very important to me, the hearts of my girlfriends, my sister, my nieces, and every woman that I know.
Awesome. Can you start off by explaining what exactly are the main causes of ischemic heart disease in women?
Ischemic heart disease, also known as coronary artery disease, has many risk factors. There are the traditional risk factors like high cholesterol, diabetes, high blood pressure, family history, lack of exercise, cigarette smoking, and obesity. But for younger women, it seems like a laundry list of things to pay attention to. I think what's important today is not only to talk about the traditional risk factors for heart disease in women, but also other medical conditions that could raise a woman's risk for heart disease that occurs when they're young, so that they stay engaged with the healthcare system. Things like pregnancy-related conditions like preeclampsia, preterm birth, gestational diabetes, diabetes of pregnancy, or hypertension that occurs, high blood pressure that occurs during pregnancy. After delivery, these conditions go away. But it's quite interesting that in midlife, then women who had these conditions can have high blood pressure or develop type 2 diabetes. And one of the challenges, and I see this in my own family because I have a niece who has 2 young children, is that once, when you're pregnant, you go to the doctor very frequently when you're about to give birth. And after you have children, you're busy taking care of your babies and not taking care of yourself. Then you're balancing going back to work or taking care of family members. And you miss those doctor's visits and you realize it's been 5 years since you've been to the doctor. So what I'm saying is it's really important for us as women to connect the dots. If you had any of these conditions during pregnancy, it's to stay engaged with the healthcare system. Make sure you make your yearly doctor's visits so nothing comes as a surprise. At the yearly visit, you can have your cholesterol and glucose checked, your blood pressure checked, height and weight measured, and know where you stand on the spectrum of heart health.
Well, that makes sense. And so, heart disease is often, thought of for older men, right? And studies are finding that young women ages 35 to 54 are an emerging high-risk population for heart disease. But when we say young, is 35 to 54 really young?
It is young because the average age of a heart attack, recent statistics from the American Heart Association, is that the average age for a heart attack in women is 72, for a man 65. And unfortunately, heart attack rates are increasing in both men and women. Every 40 seconds, someone in our country is having a heart attack. We need to intervene in these statistics, and the power is in our own hands.
So for someone in this age group that's in their 30s, 40s, early 50s, how can they get ahead of cardiovascular disease and promote better heart health?
Well, I think the 80% of heart disease is preventable because there are risk factors that we can intervene on. Think about if you took a half-hour walk a day, and you don't even have to do it 30 consecutive minutes, but split it up into 3 10-minute intervals or whatever you can do. You can lower your risk by 50% for heart disease. And regular aerobic exercise has really been shown to lower cholesterol, improve glucose by increasing insulin utilization and taking up the glucose in the cells properly. It means lowering blood pressure. And one of the most challenging risk factors is smoking cessation. And we have medications, nicotine replacement, as well as medications to help with quitting smoking.
Okay. And so you mentioned, it's different. We see that you mentioned heart attacks the average woman has a heart attack at an older age than men. But what does ischemic heart disease look like in a woman? What are the signs or the symptoms that women should be looking out for?
Well, the most common symptom on a heart attack for both men and women is tightness or pressure in the center of the chest. that is so severe that can come on at rest or awaken you from your sleep. It may be radiate to the arm, neck, or jaw and
Mhm.
associated with shortness of breath. In women, some less, some other symptoms may occur as the first symptom. You can be unusually short of breath. In other words, feel as though you've run a marathon, but really haven't made a move. The
Mhm.
symptoms of a heart attack could be lower down in the chest. I know a number of the patients I've seen over the years easily mistake it as a stomach ailment and take antacid or go online to check what heart attack symptoms are and delay getting care. But I
Mhm.
think if you experience any of these symptoms, what you really need to do is get to the hospital as quickly as possible, because we have treatments that can stop the heart attack and protect your heart muscle. So you call 911. And then oftentimes I'm asked, should someone take an aspirin? Well, if you're thinking of chewing an aspirin and it's an uncoated full dose aspirin of 325 milligrams, you shouldn't sit there and wait and see if the aspirin is working, because that's only one of the
Yeah.
many things that we do to help prevent heart attacks or stop a heart attack in its tracks. You should be simultaneously calling 911.
And so, what are, when you mentioned there's aspirin and there's some other, you said smoking cessation, stopping smoking, are some of the things that women should do either to prevent or to treat. Are there any other medical interventions that you think we aren't leveraging
We're
enough
not
for women's health?
leveraging a treatment of high blood pressure. In the recent statistics from the American Heart Association, the two factors that they figure are to be raising risk for heart attacks are obesity and high blood pressure. Now, there's
Mhm.
hundreds of blood pressure medications that can lower blood pressure. Yes, diet and exercise are an effective measure you can do on your own
Right.
to maintain healthy blood pressure. Lowering salt in your diet and following the DASH diet, which stands for Dietary Assessment to Stop Hypertension. And the DASH diet is one of the leading diets. The research was done more than 25 years ago to lower blood pressure. And the diet alone can lower your blood pressure 12 to 15 points or millimeters of mercury on your top number, but it may not be enough. And we have many medications that can work with diet and exercise to lower blood pressure. Because when you lower your blood pressure, you lower your risk for heart attack, stroke, heart failure, kidney, and eye disease. So lowering blood pressure goes a great way into lowering complications of heart disease from high blood pressure. And I want to
Right.
point out that optimal blood pressure is less than 120 over 80.
Okay. It's interesting that you said heart disease. I mean, eye disease. I
Yes,
don't think people
because we
generally
have
think about
blood
that.
vessels in our eyes that feed
Right.
our eyes so we can see. And I think people don't realize that this is a full high blood pressure influences the function of your whole body. You also
Right.
feel tired, um, and lack of energy. So, and there are easy ways to check your blood pressure. You can get a home blood pressure machine and check your blood pressure
Okay.
in addition to visiting with your doctor.
So for those that, have high risk or have had a cardiac or heart event, is heart disease irreversible? Is there anything we can do to undo the damage or to prevent additional damage?
We can certainly work to prevent additional damage, particularly for people who have existing heart disease, or prevent recurrent heart attacks
Okay.
by treating blood pressure. And we really aggressively treat cholesterol with a combination of diet and exercise and medication. And we know that the combination of all of this and making sure we're effective in getting people to quit smoking
Hmm.
and get people moving is lowering their risk for a recurrent heart attack or need for a heart procedure.
So we talked about women. That's really good. We talked about younger women, and you mentioned pregnancy. Let's talk a bit about menopause. How does cardiovascular disease risk and prevalence change post-menopause?
Well, with the changes in hormones in
Mm-hmm.
menopause, we tend to see increases in blood pressure, increases in LDL or bad cholesterol and triglycerides. The HDL or good cholesterol stays the same or goes down. And then women start to notice, because this is one of the most common things reported that I see in practice, is a gain of weight around the belly or belly fat. Menopause also decreases the flexibility of our blood vessels. So it's a really important thing to have a discussion with the doctor about your risk factors in perimenopause and even before. And I wish doctors would address perimenopause and menopause in women well before they have symptoms, because when you hear women, they feel like they've hit the wall and don't know what's happening.
Mm-hmm.
So I think that's another thing that's challenged in our healthcare system, is that there isn't a period of time when women visit with their gynecologist and get counseled on what comes next, so they're prepared. I also think that, hormone therapy is not used to treat heart disease, but hormone therapy is really effective. There are different formulations for women who are having menopausal symptoms like night sweats, vaginal dryness, difficulty sleeping. Obviously, if you're somebody in the workforce and you don't sleep, you can't effectively do your job. So we need to know that women know about their resources. In 2002, there was a study that showed hormones therapy increased risk for heart attack and stroke, but that study was actually done on women who were about 10 years into menopause, not women who were just newly going into menopause. So I think it's really important to have a good discussion with your gynecologist should you have menopausal symptoms and they're disabling or keep you from sleep or doing your work. Because in fact, you can use local hormone therapy for vaginal dryness, and that's not absorbed into the body. You can use patch forms of hormone therapy or oral forms. But you need to have a discussion with your doctor to know what's right for you.
I think that's you're going down the lane. You're driving down my road here with menopause, and I'm so glad that you said it. At SWHR, we had one of the challenges that we have been highlighting and noting in the menopause space is being prepared early and having those conversations earlier. And so we had created a toolkit that we launched, I think about now 2 years ago.
Yeah, it's great.
That was a menopause preparedness toolkit for that very purpose. Having these conversations earlier, getting ahead of it. And it was very interesting how you brought up the change in our blood vessel physiology, essentially, as we go into menopause that can cause some of those challenges that we see with heart disease. And so we really want to be able to get ahead of those conversations.
It can, and I want to add, if you want to maintain blood vessel flexibility before menopause, during menopause, regular exercise helps that.
So that helps to strengthen your blood vessels. That's really good. That's really good advice.
I saw we just got a really interesting question. Are there specific tests that should be done to determine if it is safe to take hormone therapy if heart disease runs in your family? I think that's a great question. You certainly should get your cholesterol test, and also when you get a standard cholesterol test, talk to your doctor about getting a lipoprotein A. Lipoprotein A is a risk factor for heart attack and stroke, and it runs in families. So it's important to figure out what the link is in your family if it's not obvious from the standard risk factors. And another blood test that can be done at the same time as your cholesterol test is an apolipoprotein B, because that contains the bad cholesterol and lipoprotein A. So it's important to know, and now we're in the cardiology community, we're looking at lowering cholesterol, also looking at the ApoB level to make sure it's low enough. In addition, if heart disease runs in your family, you can discuss with your doctor if you should have a CT calcium score. A CT calcium score is a CAT scan that's used without contrast or dye and measures calcium in the coronary arteries. Those are the arteries involved in ischemic heart disease. Mm-hmm. And if that calcification represents plaque. So those are some ways you can learn if you have early heart disease or at risk for early heart disease.
Awesome. So those lipoproteins, and then you mentioned the lipoprotein A, you mentioned the calcium, CT.
The CT calcium score.
CT and calcium. And then I saw someone had put in read my lips, which I guess is a shout out to our campaign for your lipids, understanding your lipids. That's your right. HDL and LDL and total cholesterol. And what was the other one? That you
triglycerides.
Triglycerides. So thank you. That is such great information. Of course, people can always go back and listen to and get that reiterated. I did want to touch base. We've talked about diet and nutrition. You mentioned walking, exercise, sleep. Sometimes all those recommendations can be very overwhelming for a heart healthy lifestyle. What baby steps would you suggest somebody to start looking into to make a positive change in their heart health?
Well, this is the second time today that we've been discussing this. Earlier today, I was at my alma mater, Barnard, for campus-wide CPR. And we had people, I was sitting at a table of people from the American Heart Association, and they said to me, what would you tell people to do to take a small step? It's exactly that, to take a walk.
Okay. Take a walk.
And who knows, it could develop into hiking in the future, but take that walk.
Just take a walk. I know there's a goal of 10,000, but you're saying if you get out there and just do a couple minutes or do what you can, right?
Do what you can, because if you do what you can and you like it, you're more likely to do more as the days go on.
Yeah, I can definitely appreciate that. Every once in a while, I count my steps, and then when I hit that 10,000, sometimes I don't even realize it, and I'm like, okay, it wasn't a stressful day, but I made my 10,000 steps, and so I kind of think about what else can I do tomorrow.
10,000 steps is not that easy to do, and if you can only do 5,000, that's okay. You have to start somewhere. Yeah.
I more than likely will get 5,000 in a day compared to my 10. And I wanted to jump into a bit of a conversation because we know you're a cardiologist and you have that specialty, but there are individuals who live in areas where they might not have a heart center at a major hospital or cardiologist, maybe in a rural setting or such. How do they consult for their heart health care? Like, who should they be speaking to? What are their alternatives?
Well, a lot of the testing that I talked about can be done at a primary care visit, and a primary care doctor can order a CT calcium score. Although not traditionally under the venue of a obstetrician gynecologist screening for heart disease risk, a family practitioner or an internal medicine primary care doctor would be a good choice.
Okay. So is a cardiology more just to have it in the video? It's more when you have an identified condition that you would now see.
That's right. A cardiologist should also be consulted if you have any symptoms. Okay. Or if you have difficulty to control blood pressure or cholesterol despite the medicines you've been prescribed.
And so we've talked about conversations and talking to your healthcare provider. How can we normalize conversations about heart health for young and older women, not just in their doctor's office, but broadly? What
Well,
have you seen that has worked?
we have to encourage younger women to ask the questions about their health and as cardiac health, particularly getting a cholesterol test and blood sugar test, and talking about and knowing your family history. Because if you're a young woman in your 30s and you had a parent or a brother or sister who had heart disease in their 40s, you have to be more aggressive about learning about your risk factors.
And so family history. So you have to have
Yeah.
conversations with your family, essentially.
I know in some families it's challenging because sometimes families don't want to upset their children about their health history, but I think it's really important.
This has been really great. Thank you so much. I don't, want to keep you too long, but before we close out, do you have any final words of encouragement for those who are watching?
You know, there's a lot of talk in the community about longevity medicine and things like that. The first step to living longer is to have a healthy working heart. So I encourage all women to take small steps, whether it's making a doctor's visit to get an assessment or taking a walk. And then what I'm going to also ask you is to invite a friend to join you and have that friend invite another friend.
Make a community support
That's right, a real grassroots effort.
That is such great advice. And so you all have heard it right here. I'm Irina Ninge at Society for Women's Health Research, and special guest, Dr. Nisha Goldberg, encouraging women to have those heart-to-heart conversations with your healthcare providers and your loved ones. Yes, our conversation centered on women's heart health, but everyone can take advantage of these great tips for promoting heart health each and every day, no matter your age or your gender. SWHR invites you to visit our Women's Health Dashboard online to learn more about heart health and ischemic heart disease in women. And let's keep the conversation going with hashtag SWHR Talks Heart. Thank you for joining us. Have a great rest of your day. Thank you, Dr. Goldberg.
Bye. Take care.
Bye.